You are listening to a recording from the 2021 PM&R Scholars Virtual Residency Fair. We would like to take a moment to thank the residency programs who have taken the time to present at our fair this year. This year's PM&R Scholars Virtual Residency Fair is supported by PM&R Recap, the best resource for your physiatry clinical preparation, audition rotations, board preparation, and beyond. PM&R Recap offers 35 hours of review videos, hundreds of review questions, and even oral board cases. Head to pmnrrecap.com to learn more.
Hey guys, let me get my screen shared. But welcome to Arkansas. I'm on the floor of one of our residents' homes. Where is he? I don't know where he is. There he is. Dr. Botaforano. He's hosting us tonight. He's behind the bag of chips. We like to snack. And then I also have one of our attending, so he's one of our PGY3s. And then we've got one of our other attending physicians, junior faculty, Dr. Lindsay Mustay. She's right behind me. She likes to hide. And then one of our chief residents is on the other side of her, and she's a PGY4. They get chairs, I get the floor. But that's because my computer was dying and I needed access. All right, share my screen. Okay, everybody can see. Awesome. So let me tell you a little bit about our program, and these guys behind me are going to be watching the chat. So if you have questions as I'm talking, definitely put them in there, and we can try and answer them as we go. Make this a little bit informal. So I've got these guys watching that for me. So number one, thanks for hosting us. We loved doing this last year. We're excited to do it again this year. It's a great way to get our name out there, let you guys learn about our program. And so we're super excited to be here tonight. This is our crew of residents. We like to have fun. We are a group of 16. We are a categorical program, and so our interns are with us from the get-go, and we help create their schedules and help get them in with us during the PM&R wellness activities, et cetera. Some clinical time with us too during that intern year, which I think is one of the things that's unique about our program. And so just a little bit about who runs the program. That's me in the middle. We obviously have a lot of personality. Dr. Kevin Means, he's the department chair and has been for quite some time. Our program's been around since 1980, but he also plays the role as an associate program director. I booted him from the position and knocked him down a level. And then Lee Austin is our amazing residency program coordinator. She put the slides together for us today, so I'm sure she put some surprises in there for me to try and throw me off today, but she is on vacation driving all over I think Santa Fe and Texas and up through, I think even up in the north through Idaho and Montana on a 2-week vacation. So unfortunately, you guys don't get to meet her today, but she's amazing and helps really keep our program running and adds lots of personality to us too. All right, so our curriculum. Our PGY1s, like I said, we are categorical, which is one of the great things about us is you join us and you only have to move once. And you're here for 4 years. And so our interns spend a month with a bunch of different services that we feel have play some kind of role in your training during your PM&R years. So cardiology, emergency medicine, they do 3 months of medicine wards at our VA hospital, geriatric wards at the VA, a neurology rotation where they get a lot of general neurology exposure plus stroke exposure, orthopedics. We do a month of PM&R inpatient during that intern year, pediatric wards, rheumatology, a month of radiology, and then our interns also get to participate in continuity clinics where they're assigned to some of our PM&R clinics during their rotations. Then our PGY 2 to 4 curriculum, pretty standard. We do ours in 3-month rotational blocks. And so you'll get to spend 3 months straight on a specific rotation. So 3 months inpatient, 3 months outpatient. We find that it helps with continuity of care, especially in the inpatient world. When some of our patients have lengthier length of stays, you really get to be part of that. And then we try and follow that inpatient with the outpatient rotation, so you get to see them in follow-up in clinic. So we do try to create some continuity of care with your patients. But you really get to know your attending physician. It takes a lot of folks, a month to get settled in, and then you've got that last 2 months to really build your confidence level and comfort level and your expertise, and hit those milestones by the end of that 3-month rotation. So we do at least a minimum of 12 months in, 12 months out. The outpatient is in consult rotation is at our university hospital, which is our main campus. There is also a children's hospital rotation, both inpatient and outpatient. So we have a 3-month in, 3-month out. And so if you're pediatric minded, this is a really great opportunity to gain that exposure. Our inpatient rehab is at a freestanding private practice inpatient rehabilitation center in Little Rock that has affiliation with the university. So at Baptist Health Rehabilitation Institute here in Little Rock, Arkansas. We see strokes, traumatic brain injuries, spinal cord injuries, amputees, all the classic rehabilitation diagnoses that come through that hospital. Then the residents also rotate through the VA on a EMG specific rotation. And so 3 months of just EMGs. So no trouble gaining your numbers for graduation and for meeting your EMG milestones with that level of exposure. And then outpatient, both at the VA and UAMS. So on the UAMS outpatient rotation, you get tons of exposure to a lot of different rehab pathologies. Our facilities are pretty new, and in fact, they just broke ground on a new freestanding but university associated surgical hospital on campus that will house PM&R, ortho, and interventional spine and pain. And they're hoping that that'll be completed in probably 3 to 5 years. Just depends on how fast they can get supplies here and all of that stuff that's been slowed down because of the pandemic. But so state of the art, pretty new facilities. The PM&R clinics on the second floor of the Jack Stevens Spine Institute. That building's only been around since 2006, so it's pretty new as far as buildings on campus. So great technology. We do some off-campus clinics in satellite clinics. So there's the orthopedic Colonel Glenn Clinic. We have a spasticity and brain injury clinic there. And then the residents on that rotation spend time with the university's anesthesia and interventional pain group. They do consults at UAMS, which is the only level 1 trauma center in the state. And then they do spend at least 1 day in the ACH burn clinic. And then we ask that they try and spend some time on the burn unit as well, which is also an option during their children's rotation. We do have some really supportive adjunct faculty in the community who also sponsor our residents during their outpatient rotation, where they'll get even more interventional practice, interventional exposure, and then also some regenerative medicine and osteopathic medicine exposure too. Our inpatient hospital, like I said, was Baptist Health Rehabilitation Institute. It has, is it 70 beds now? I can't remember. 72 beds. It is probably the most experienced rehab hospital in the state, one of the most established ones. It's the only one with the university affiliation. And so our physicians, in addition to some of their private physicians, staff the hospital. They also, the therapy staff have teaching credentials for the physical therapy school that is about 30 miles from Little Rock. Those therapy students rotate at our rehab hospital. So we have learners in every discipline there, which is awesome. It is the largest, most comprehensive rehab facility and probably has the highest level of rehab technology offerings. compared to a lot of the rehab hospitals in the state. It is the only facility right now that is CARF accredited and certified in all the major rehab diagnoses. So brain injury, spinal cord injury, amputee, stroke by CARF. Which is great. We also have physicians in those areas of expertise as attending physician rehab specialists. Arkansas Children's Hospital is amazing. If I liked practicing medicine on kids, I would definitely want to work there. It's one of the most beautiful facilities as far as children's hospitals I've seen. And it's usually top ranked in the nation pretty frequently because it's just such an amazing facility. Our residents get to spend outpatient and inpatient time there in the habilitation clinic where they see muscular dystrophy disorders, EMG on pediatric patients, spasticity, Botox clinics, spina bifida clinics. They have some multidisciplinary clinics, which are awesome. They do community outreach clinics too, which is fantastic. And then they've got, I said muscular dystrophy. And then they do have a 10-bed inpatient unit there where they can even handle ventilator patients, so they can handle some of the high quads at times. And then they see PM&R consultation at that hospital. So they stay busy and they do a great job. The Central Arkansas Veterans Health System, we do have a VA hospital. It is right next to the University Hospital, and so there's not a whole lot of commuting for the residents to do, literally just a walk across a skywalk or a walk across the street. Our PGY1s do spend some significant time there when they're doing medicine wards, geriatrics, cardiology. Our PGY2 through 4s will do EMG there, and then they have a split rotation where they spend half the time at UAMS outpatient clinics and half the time at VA doing their interventional clinics with those physicians. While our residents are rotating at the at the VA. This is one of their favorite times, favorite rotations, because they don't have to take call when they're at the VA, which is exciting. It's split between the rest of the residents. Are y'all making fun of me back there? Stop.
It's exciting.
Oh, because he gets to have VA rotations. Oh, lucky Veterano this year. Okay, so this is something that I think is really special about our program. When you enter our program, everybody is assigned to a mentor group. Our mentor groups are the working groups of our program. So each mentor group consists of a resident at each training level, so PGY 1 through 4, and then at least 2 faculty members. And so these are just randomly assigned. They're not based on specialty interest or anything like that. These are just folks that are assigned to you from the start of your residency, so that you have somebody that you can go to ask questions of at each level of training, a faculty member who's going to check in on you. But they also serve as working groups for scholarly activity, quality improvement projects, to help each other formulate and create and draft and edit their seminars and presentations and writing up papers. So these are the working groups, so that you always have somebody who can help you. Already there. Now we encourage, everybody is of course encouraged to reach out to other faculty and residents who have specialty areas of interest or anything like that, to work with everybody. Of course we like that, but it's always nice, especially if you are not from our program and not from the area, to have somebody there that you know that you can reach out to when you join our program. It has really helped in terms of productivity for at least, getting abstracts written, posters submitted for presentation, quality improvement projects that we're using at the hospitals, creating really good quality morbidity and mortality conferences. So the groups work together to do all of that. And then they also work together during the anatomy block when they're assigned certain anatomical sections to help teach their peers. So they work together. So no one person is responsible for things. They do work as a group, and it's wonderful. Did you say faster?
Yes.
Okay.
5 minutes left.
No, we have fun too. Sorry, I talk a lot. All right, we have fun too. There's so much to do in Arkansas. It is similar to Texas. We do have lots of lakes. So we have lots of natural lakes. We've got some man-made ones too. But we like to have fun. We like to take advantage of that. We like to go to conferences together. We eat together. You know, this is just a small selection of pictures that we picked that I think represent what we do. It looks like we eat a lot because we do, but we do like to have fun and fellowship. We like to take advantage of what the natural state has to offer by going out hiking and floating and playing outdoor games. Like during the pandemic, small groups are meeting to play Frisbee and soccer and go biking and running together, playing golf. And so we'd like to take advantage of all of that. Arkansas is beautiful. Right now it's very hot, which can be kind of miserable, but you can always find some water to cool yourself and take a good swim. Searching for waterfalls, hiking for waterfalls is a big thing here. It gets really awesome when the weather starts cooling down, and in the fall where you can take advantage of a lot of this. And so I'm from here and I haven't left because I think it's amazing. And a lot of times we'll have folks come here for training and then they don't leave, or they come back, or they give back because it's just such an amazing place to be and live. And so there's just more pictures. We like to show off our state. All right, with that, I will let the others take over, answer questions for you guys. What can we answer? Y'all have any questions?
Yes, the first one.
Yeah, go ahead.
So the question on the board is, what is the number one thing you are grateful for in your program? You gotta mute. Okay.
Turn your sound
volume.
off, and then let's continue on.
Is that better?
No, put on your actual computer. There you go.
So I think the number one thing I'm grateful for is the group of people we have here. So I think you can tell by the pictures in our slideshow that residents really get along together. The attendings are super approachable. I feel like it's an extension of the family that I have here. And so I'd say that's the number one thing I've been most thankful for.
2 minutes left.
Is your mic on? I would have to second that. I think I'm most grateful for the people that I've met here. It's a very casual environment. It's easy to get to know people, and I feel like we have a pretty laid back program as far as just personalities. Everybody gets together a lot. Everybody gets along really well. And that's probably one of my favorite things about this program. Next question. Okay. Yeah, our residents kind of go all over after graduation. I think we've had even just recently people go into interventional pain, sports med, peds, people just going right into practice right afterwards. It's super variable, brain injury, just kind of everything, just about. Yeah. What other questions do you guys have, if any? Yeah, a couple of the attendings do, not a ton, but we have one of our private practice physicians that we spend some time with on outpatient. He does OMT pretty regularly. One of the peds attendings occasionally will do some, and she's proud of that. And so she'll do that sometimes. There's a couple every now and then. I mean, they kind of just use the OMT skills just as in addition, or even just like with our MSK exams, just having that extra skill and being comfortable using your hands is really helpful. I feel like just in the specialty in general.
Ooh, I'll do the good about the area that surprised you. So Little Rock is surprisingly super awesome for food. And so if you like any type of cuisine, it's amazing here. Chain restaurants actually don't do very well here, and it's all just local food. It's quite surprising when you move here.